Evening. The practice today is focused on mobility, and that could mean a lot of different things. And for me, I sort of think of it as two different ways. Joint mobility, so the actual joints in our body, like the knee, the elbow, the shoulder, the joints in between the vertebrae and the spine, and many more, all are surrounded by joint capsules. And when we gently move our joints, it actually allows the lubricating fluid that's secreted by the joint capsule to circulate. So when we don't move, there's no circulatory system for that joint capsule. When we don't move, the lubricating fluid sort of settles to the bottom of the joint capsule and we feel stiff. So that's why you feel stiff if you've been sitting for a long period of time, when you first get up in the morning, and why you feel better once you've been moving around a little bit. The other mobility is thinking about mobility between the tissues in your body. And by tissues, I mean skin, muscle, fascia, where the nerves are embedded in the muscle or the skin, where the veins and arteries are embedded, where the tendons meet the muscle and where the tendon meets the bone. And the mobility of the joints also mobilize our tissues. And so you have layers of tissues that when we move our body, they move back and forth over each other. Lubricating fluid is also secreted by the fascia, this connective tissue that's everywhere in our body. So movement helps that lubricating fluid be secreted. So we are going to be doing some gentle, repeated movements. And even though I'm saying gentle, it might be that some of these movements don't work for your body. So please modify, adapt, adjust, substitute at any time during the practice. And as far as props go, we do need a blanket or a towel. If you have yoga blocks, I would grab them. If you don't have them, you can get by without them, but we definitely need the blanket today. And we are starting in a position where we have the rolled blanket under the neck, under the back of the neck. So I've got a pretty big yoga blanket here. I'm not using the whole thing for the roll. I'm going to make about a 2-inch, 2.5-inch diameter of roll that is going to go under the back of my neck here. So I'm lying down, and I almost always have to adjust this. Now I made this too big, and I can tell because it's kind of shoving my neck and my head forward a little bit. So what I want is the size of this roll to take up the space between the floor and the back of my neck, supporting the back of the neck here. And depending on if your neck is really long, sometimes having that roll up closer to the base of the skull feels better, sometimes in the middle or a little bit lower. So you might be adjusting where or the position is on your neck. Well, starting here in some stillness. So getting comfortable and making the adjustments with your blanket or your towel, legs and arms in whatever position feels restful to you, because we want to turn our focus to our breath. So observing, noting movement of the breath in the body, ribs, the belly expanding as you make space for the inhale. And this passive release, contraction of the belly and the chest as you exhale. Start to lengthen your breath so you begin to slow your breathing down here. The breath itself is mobilizing joints, tissues in the body, So that expansion of the rib cage, the belly, and then that release, already mobilizing the joints and the rib cage where the ribs meet the spine, where they meet the breastbone. Movement of the diaphragm, stretching, releasing belly, lower ribs. Take the next few breaths to set an intention for your practice today. So, calling your reason for being here, your reason for setting aside time, whether it's about feeling better in your body, finding more mobility, releasing tension, connecting the mind and the body, relaxing. Whatever your reason for being here, bring this thought to the front of your mind and breathe with intention. So I'm going to begin to move from here, and I'm keeping the roll under the back of my neck. If this is feeling uncomfortable to you, you could take it out and do the same movements that I'm about to do here. So knees bent and feet flat. The head and neck are going to be relatively passive, and we're moving from the pelvis and the low back, flattening the lower back into the floor, tipping the tailbone towards the ceiling, and then moving in the opposite direction. Press the tailbone into the floor and arch the lower back from the surface. Flattening the back on the exhale, tailbone tipping up, arching the back away from the surface on your inhale. And go back and forth here a few times. This doesn't have to be a huge movement. And even though your focus of movement that you're controlling is happening at the low back, the pelvis, rocking forward and backward, feel what's happening here at the head and the neck. So when you flatten that low back, the chin kind of tips away from the chest, head tilting back. When you arch the low back from the surface, it pulls the chin down towards the chest. And what I do with my physical therapy clients sometimes when they have a stiff neck is I do manual mobilizations of their spine, very gentle ones. I'm working around the neck, and it's hard to replicate yourself. And this is one way to do it. And then we'll bring this back into a relaxed position of the lower body. Bring the arms out to the sides here on the next one, palms up. And start to gently rock your knees side to side. So now we're tilting that pelvis left and right instead of the forward and backward. And for me, I don't feel much pull here on my neck, but I'm going to start to slightly turn my head in the opposite direction of the legs. So knees go left, head goes right. And if you still have that roll there, it's going to limit your movement a little bit, and that's okay because we're not trying to crank the head around here. You might choose to keep going with this, just that kind of head turn, knee rocking, or next time your knees come over to one side, pause, that head is turned in the opposite direction, and do a tiny little head nod, almost imperceptible, chin towards chest, release. Exhale, chin towards chest, inhale, release. And do a few more here. So you might feel that ledge of the, or edge of the blanket kind of pulling on the ledge, the base of the skull here. And let's try the other side, knees, turn, head turns the other way. Tiny little head nods, exhale, chin to chest, inhale, release. That blanket's going to stop you from making too big of a head movement, which is good. What we're doing here is really isolating the movement where the skull meets the topmost vertebra. Tiny little movement here. All right, we'll bring it all back in through center. And you could keep that blanket there or take it out from underneath. We're pulling the knees in towards us, holding to the shins or the backs of the thighs here. And you could gently rock or circle the hips and knees. So the lubricating fluid in the joints is called synovial fluid. The synovium is that joint capsule around surrounding each joint. And the lubricating fluid secreted by the fascia is called I can never say it, hyaluronic acid, which if you've ever looked at any like face lotion aisle, you'll see that is often what's in it. All right, we'll bring that knees back through center, lower one foot down, holding the back of the thigh of the other leg. And instead of pulling in close, let the elbows straighten out. We're doing a little sciatic nerve glide with this position. So that leg you're holding on, straighten that knee and reach your heel towards the ceiling. But don't straighten all the way. Keep it at least slightly bent. And then bending the knee, let the foot come down. So we inhale, reach that heel up towards the ceiling, and then exhale, release the bend of or straightening of the knee. So I'm holding the back of the leg the whole time. I'm not letting the foot come all the way down to the floor. And I'm sort of jutting my heel towards the ceiling. And for me, I've got some issues on this side, so I'm feeling my sciatic nerve pull, tug here pretty quickly into the motion. So I'm being gentle with it. All right, lower that foot down and we'll switch sides, holding the back of the other thigh. Start with the knee bent, shoulders relaxed, elbows straight. We start to straighten that knee, jut the heel up towards the ceiling, and then let the knee bend. Keep it slow, keep it gentle. So as I was talking about before, our nerves are embedded in, kind of tucked in, held inside muscle fibers, in the skin. It's held in by connective tissue, also called fascia. And so we're just loosening up any of that fascia that might be tightened, bound down, stuck around that sciatic nerve. All right, lowering both feet down here, and we're rolling over to come up into the side saddle, side seat position here. So our legs are kind of swept off to the side, and we're leaning away from the legs here. So there's hopefully no stress put on the hips. And you could always do this one on your forearm instead of on the hand. The free arm, we're reaching up and we're making this thread the needle movement. So threading this arm underneath the supporting one. And you could pause here or bend that arm for a bigger twist if that feels good. And then you inhale, sweep and open up. We exhale, thread through. Inhale, opening up. We'll do 2 or 3 more here. So it's actually a lot of movement happening, turning of the head, rotation of that mid and upper back, shoulder movement, shoulder blade, moving forward and backward on the back ribs and side ribs. All right, we'll come on up here and then we're switching sides. Swivel those feet off to the other side. Knees closer or further apart, whatever is most comfortable to your hips, leaning away from the legs. Other arm up. We exhale, thread it through. Inhale, opening up. So, especially with the repetitive movement of your arms in rowing and needing to reach and pull back, shoulder blades moving forward and backward here. If you have any stiffness, tightness, immobility in that area in the mid and upper back, and especially around the shoulder blades, it can really limit the effectiveness of each stroke, not to mention cause pain. All right, we're coming up here to hands and knees. I'm going to use my blanket here to pad my knees. My upper back was feeling kind of tired and even kind of a little burny and achy just from my day, and already feeling better after that little bit of movement. Looking forward to the next few things here, getting that spine to mobilize a little bit. Tabletop, knees under hips, wrists under shoulders, and remember you've got some options with the hands. It could be loose fist or on your forearms, maybe like the fingertip option, tinted fingers that we sometimes do. Cat and cow, but we are initiating the movement with the tailbone. So if you're unsure of this, you might watch on the first one or two and then join in. So we drop the tailbone down first, round through the lower back, round through the mid back, the upper back, and then tuck the chin at the very last of the movement. And then the tailbone gets us out of this. So tip the tailbone up, pelvis tips forward, belly towards the floor, chest forward, lift the head at the end. And again, tailbone initiates. So we exhale, drop the tailbone, round through the spine, like one vertebra at a time. Not really, but imagine that happening. Tip the tailbone up on the inhale to unroll, unfurl the spine. Go back and forth a few more times. So for me, this makes me really slow down and sort of appreciate every little angle of movement, where I feel it in the low back, that mid back between my shoulder blades, the neck, the broadening of the collarbones and cow, the moving apart and together of the shoulder blades. Your next inhale will bring this back into a neutral spine positioning here. Coming into a child's or puppy pose. So child's pose, hips over heels, forehead resting. And this works for a lot of us, but if you have osteoporosis, herniated disc, hip or knee issues, puppy pose, which I'm demonstrating here, might be safer, more comfortable. It's hips over knees, forehead and forearms down. This could be a resting position for you. Remember, you can rest at any time. We're going to add a little side bend to this. I'm going to turn just so you can see me from the front view. So whether you're in child's or puppy, this works. We're going to lift the head and walk the hands over towards one side. Lower that head back down. Now, if the head doesn't rest easily, maybe you place a loose fist under the forehead or slide a yoga block under there, but make sure you're reaching out through the arm that you are shifting away from. So I walked my hands over to the left and I'm reaching out through my right arm. And even though this is a static position, right, we're not technically kind of mobilizing through the joints. Feel what the breath is doing here. Remember I said at the beginning, even though we were still, we were mobilizing some of the joints of breathing. So feel that here in the side ribs, maybe in the lower back, maybe the lats, getting a little more stretch and then release. All right, walk it over to the other side, feeling that side there. And it's easy to stretch too far in this one. I feel like I stretched a little too far because when I took my inhale, I was like, oh, that's a little much, Laura. And I just walked it back a half inch, much more comfortable, allowing me to take that breath. Walking this back in through center here. We're coming back into that child's or puppy pose, stretching both arms forward. A little sequence of moves from here. So we'll lift the head and shift the torso forward into this knee down plank position. Lower all the way down to the ground. From here, pull the shoulder blades towards the spine and the back waist to lift the head and chest for low cobra. As you lower, turn your head, rest the cheek on the ground. Coming up, again, shoulder blades towards spine, the back waist, lift the head and chest. Exhale, lower, turn your head the other way. Let's do that one more time to each side. So take your time, really feel the shoulder blades lifting the head and chest. Little head turn. So here we are, mobilizing through some of the spinal joints at the neck, the upper back, the shoulder blades. Shoulders back in town this time, and then lower the head, just keeping it neutral. You could stay right there with that one. That might be enough for you. If you're stiff or tight or have a sore neck, I'm coming into what I call this twisting cobra. So bring the hands out to the sides, elbows bent, pointing towards the ceiling. I'm up on tented fingers here, so there's less pushing with the arms. We inhale, lift the head and chest. Again, it's that shoulder blade muscular strength. And then lower one shoulder and look away from it. Inhale, lift the head, chest through center, neck long. Exhale, lower the other shoulder and look away. Let's do that one more time to each side. Here's a little bit more of that movement of being able to look over your shoulder to see what's behind you. Right? If you're in a single, being able to see if you're going straight or in the direction you need to go. We'll bring the hands underneath us here, press yourself up, pull the belly in, find yourself back in that child's or puppy pose. Take a couple breaths here. And you could stay longer resting there or find your way to hands and knees. We're bringing one foot back, toes are tucked under. So we often do this one here in this practice, and it's mobilization for your toes, your ankles, calf, and shin muscles. So you're pressing the heel back. You might feel that stretch in the calf, and then shift forward by bending the toes. So exhale, heel back. Inhale, shift forward, toes bending. And a few more here. So, we've talked about this in other yoga practices, but that ankle mobility, the toe mobility, very important in the catch position, coming in and out of the catch position, right? Stiffness there is going to limit your position. Lower that knee, switch sides. Keeping the breath. And not just those joints again, so thinking about those layers of tissue in the sole of the foot, the plantar fascia, in the calf, around the Achilles tendon, where it meets the bone, where the tendon goes into two calf muscles back there. There are other little stringy muscles along the calf that come down and attach on the foot, the toes. Lower that knee back down. So I'm going to set myself up for down dog. This can be a challenging pose, but it is I think, one of the great ways to mobilize so many joints at once, especially the feet and the ankles. And you can always do a little bit, come down, or stay with that toe rocking. Hands a little forward of shoulders, fingers spread, hips up and back. Now I'm feeling pretty tight in my calves, so I'm going to bend my knees a little bit, reach the sitting bones up and back to lengthen the spine. And then I'm taking a moment here to pedal the feet. So it's a similar motion to what we just did, right? But there's a little more oomph behind that, pushing the heel back. You could always rise up on the toes, release the heels, a sort of simultaneous heel and toe rock. Shake that head out, let it relax between the arms. Settle into down dog, spine long, looking forward. We're stepping the left foot to the outside of that left hand. So it's coming wide. If it doesn't get all the way there, lower that right knee, left hand helping this foot come forward. While you have your hands down, this leg that's back, that right leg, rotate the toes to point towards the left side of the mat. So your shin is on a diagonal here. And then find yourself in that upright position. I'm going to bring that left leg out a little bit wider. I'm going to turn to face you just so you can kind of see a little bit more of what's going on. So my left leg's out like 30 to 45-degree angle here. This is a mobilization for the hip joint, the ball and socket in here. But we want to control where the socket is by tucking the tailbone under. Right, this tucks or rocks that pelvis backwards, so that's the socket part in there. We're going to hold. And then we bend through that left knee and then come back up. So tailbone tucked under, whole time we inhale, bend through the knee, exhale up. And sometimes I have pretty tight hip joints. So sometimes I get here and I'm like, I'm a little too far out. I got to bring that foot back in. or my foot's too far like forward of my knees. So make the adjustments you need to here. And so you might be feeling some inner thigh stretching here, but this is more about mobilizing through the hip joints. Right, coming back up from here, bring both hands down to the floor and step it back into a down dog again. And take a few more whatever mobilization, mobility things you want to do. Shaking the head, lifting, lowering the heels, swiveling the heels side to side, a little side body length and release. Come back into center, studying yourself. Look forward, right foot steps to the outside of the right hand. Lower that back knee. So remember, left foot, toes are going to point towards the right side of the mat. So my shin's like in a little diagonal here. Toe heel that right foot out, so you're 30 to 45 degrees out to the side. I'll turn so you can see me here from the front. And then you're tucking the tailbone under. So I'm flattening my lower back. Keep that. Bend through the right knee and rise back up. Breathing with this. Some of these things I'm doing with you today are things that I do when I go to the gym before I lift, right? Working on my hip mobility so I can go a little deeper in my squats. Working on my shoulder mobility. So when I'm doing overhead press or pulling, I'm working through a larger range of motion. I'm strengthening through a larger range of motion, and certainly a more comfortable one. We'll bring it back up through center here. And you could toe heel that right foot onto the mat again. Step the back foot to the front foot and find your version of forward fold. The ragdoll, knees a little bent, upper body draped over. Or this one more protective of the spine and hamstrings, it's feet wide, butt back, forearms on your thighs. So especially if you are working with low bone density, herniated disc, tight hamstrings, here's your version that is safer for your spine. Feet wide, butt back, forearms on your thighs. Either pose, a little sway, a little shift side to side. If you're in that ragdoll, you can let the top of the head hang towards the floor, shake it out, or hold elbows. So you'll see, right, we're not doing the static stretch or static hold here, but we're moving, we're mobilizing through the joints, the tissue. We'll bring this weight shift into center, bend the knees, strong legs. Inhale, rise up to stand, reaching up. Exhale, hands to prayer. Let this go. Shake it out, roll those shoulders. Move that blanket out of the way if you had it there. I'm going to have you turn to face the left side of your mat and step out wide. So feet wider than shoulders, toes are turned out. We're setting up here for a goddess pose, which is basically a wide-legged squat position. So we're bending through the knees and bending through the hips. You're in charge of how deep you go, right? You could go super deep. You could just be a few inches of bend here. Doesn't matter. Especially we're not thinking about strength, we're thinking about mobility here. So that spine is long. So when you bring tailbone down, top of the head up, we create space between the vertebrae, easier to move the spine, which is where we're going with this. Knees, hips stay bent. We hinge forward and bring the hands to the thighs. I'm going to turn just so you can see me here from the side a little bit. So remember that twisting cobra. This is a very similar movement. So the spine is long in center. Press out through your hands and then lower one shoulder straight towards the floor and look away from it. Bring it back up through center, lengthening the spine. We lower the other shoulder towards the floor, look away. Inhale through center. Keep going. You twist on the exhale. Inhale, lengthen spine through center. A few more times here. And don't skimp, don't pass through that lengthening in the center, right? Because remember, that's us creating space between the vertebrae, so we have more room to twist. We'll bring it back in through center, and then strong legs, rise up, roll those shoulders back and down at the top of that movement. All right, turn your left foot inward and your right foot towards the front of the mat. So we're coming into a warrior two position, front heel roughly lining up with the arch of the back foot. Bend that front knee here. Again, we find that length in the spine, the tailbone down and the top of the head up. Lower body's going to stay here. We're reaching our arms forward and backward here. Palms facing down, shoulder blades sliding down the back. And keep the front palm down, but turn your back palm up. And just glance towards the back palm here. We're adding a little nerve glide here, median nerve glide. So we're tipping those back fingers towards the floor and then let them pop back up. So you tip your fingers from the wrist, so the wrist angling down, and then bring it back up. Once you know what you're doing, you could gaze over that front hand here. So you're going for this sensation of stretch or a little pull on that forearm, maybe into the palm here. This might be a really tight area for you. This is the carpal tunnel that's under the wrist there, that median nerve. All right, we're going to release the arms, straighten the front leg. You could swing those arms out here. Rebending that front knee, and either bring the front hand to the thigh or the forearm here to the thigh. Use the leverage of the arm against the leg to open that chest a little bit more here. So this back arm, we're going to make a big circle with it. So we let it come down across both legs, up and over the head. As the arm comes up, open the chest. Let the gaze follow that moving hand as it comes back, down. Inhale, sweeping it up and back. Exhale, bringing it down and forward. One more. That arm lifting, lifts your torso back to that warrior two. And then we're going to step the back foot to the front foot. Could be one big step or a few little toe heels and step it in together. Shake it out, roll those shoulders. So I'd like you to stay at the front of your mat. I'm going to switch, which is the front of my mat, so my back doesn't end up to you here. So now you're facing that right side of the mat. Toes are turned out. Bending through the knees, bending through the hips. We're going to change it up a little bit here on this goddess pose. Instead of the twist, moving that mid and upper back forward and backward. So tailbone down, top of the head up. Hands behind the head, interlacing fingers. Lower body stays here. We exhale, elbows forward, drop the chin. Inhale, elbows back, lift the chest. Exhale, elbows forward. Try not to push downward on the head here. And then opening up a little bit. Couple more. Lift the head, release the arms, straighten the legs. Maybe you roll those shoulders back and down a few times. That's mobilization here too. All right, turning that right foot inward so it points towards the right side of the mat. The left foot towards the front of the mat. Left heel, right arch, roughly aligned. Bending that left knee, the front knee. Tailbone down, top of the head up. Arms reaching out here in that warrior two. Shoulder blades sliding down the back. Flip your back palm to face up. Maybe you glance back there. So we're cocking the wrist so the fingers point towards the floor. And then we let it pop back up. So inhale, palm facing the back of the room. Exhale, lift. Do a few more here. You don't need to watch it once you know what's happening. You want to feel that stretch, the tug, the pull on that forearm, wrist, maybe into the palm, sort of middle finger area. That's the sensory distribution of the nerve. We are gliding, that we're trying to loosen up that fascia around it. All right, straighten the front knee. You could swing those arms a little bit here, shake out the hands if that felt a little weird or nervy. Rebend that front knee. Here's our side angle. Hand or forearm on the front thigh. Leverage of the arm against the leg to open it up. And then the back arm, we're making this circle. So we sweep it across the legs towards the floor, up overhead, behind. So exhale, sweep the arm down and forward. Inhale, bring it up and back. And I'm turning my head to follow this moving arm, right? That's going to help me get that upper back rotation. That helps me get that shoulder blade movement on the back ribs. Next time you sweep that arm up, let it pull you up into warrior two. Step the back foot to the front. Shake it out, roll those shoulders, do a little dance. We're going to come back to some mobilization for the foot and the ankle. It's similar to the toe rock we did on the hands and knees, but we're going to do it from standing. And then we're going to go directly into a balance. So it might be that you come over to the wall to have a hand on the wall, or find a steady piece of furniture, or just come off your mat for a less squishy surface, which helps with balance. So I'm going to pull my pants leg up just so you can see my feet and ankles. So I'm stepping forward here. It's not a big step. So this is not like a warrior one or a big lunge position. It's a small step here. And I've got both feet facing forward, both hips facing forward. I'm shifting my weight onto the front foot. The back heel comes up, right? So I'm toe bending. Here's that toe rocking movement. And then I shift the weight onto the back foot. Front toes come up, or the front of that front foot comes up. So we shift forward, back heel up, shift back, front toes up. And maybe you get your arms swinging in the direction that you're shifting your weight. You might have to adjust the feet, right? Sometimes too short or too far apart feels awkward. So make it an easy shift. If they're too far apart, you kind of have to like use a little oomph to get forward. So we're already working on balance here, right? We're kind of partially lifting one foot. Go ahead and focus your gaze on the spot straight ahead. That visual feedback is going to help you with balance. You could stay right here with this, or next time you shift forward, lift the back foot and then lower, shift back. So it's just a brief balance of lifting that back leg. You could keep it there, keeping up the mobilization, or pause with that back leg up. Relax the shoulders away from the ears. Feel all the little movements happening at the foot, the ankle, the lower leg. We just mobilize that area, right? So when we have more mobility, the nerve is not trapped down, the sciatic nerve. It's easier to make those small little adjustments. All right, bring the foot down, shake it out, roll the shoulders. We're going to do this on the other side. So other foot forward. That small little step, both toes point forward. You shift your weight to the front foot, towards the back foot. You could start to sweep your arms in the direction you're shifting your weight. I like to assign a breath to the movement. So I inhale forward, exhale back. Focusing the gaze on a non-moving spot here. You could stay with this, or next time you shift forward, lift the back leg, lower it as you shift back. What's nice about this is we get the balance. We're actually working glutes and hamstrings of that leg we're lifting. But you don't have to hold. But if you'd like, shift forward, back leg up, shoulders relaxed away from the ears. Keep the tailbone lengthening down towards the floor instead of a big banana arch in the low back. Are you breathing? Did you remember to breathe? All right, foot down, shake it out, roll those shoulders. We are coming back down to the floor in that sort of side seat, side saddle positioning here. So we're bringing the legs off to one side. So I'm bringing my legs off to the right side here. And we're doing a little twist or rotation for this. So since my legs are off to the right, I'm going to bring my left hand a little bit behind me off to the side. The right hand is coming to that left knee. And then lengthen the spine. If it's hard for you to be upright, I'd like you to kind of lean away from the legs a little bit and get that spine long. And just gentle rotation of that chest, the gaze over towards the left side. Try to relax that right hip. It wants to kind of engage here, likely. And then we're going to try a little head movement. Think about where your chin is and tip the chin up a little bit, stretching the front of the neck, and then bring the chin down towards the chest. So we inhale, chin up, exhale, chin down. Shoulders released away from the ears, mobilizing through the joints of the neck. And this fascia, muscle, skin here on the front of the neck, it can get really tight, really bound down. Pull the head forward. All right, we're going to release that twist and then lean away from your legs. Quad stretch of this leg furthest away from us. So I'm going to bend the knee, reach back with the hand to find the foot. You could stay here. This might feel like enough stretch to you. You could lower down onto that left forearm. Optionally, you could slide that thigh back a little bit for more stretch. And just take a few breaths here. Try not to kind of sink into that down shoulder, rising out of it. What we're not doing in this class is sort of tissue mobility you can get from a massage therapist. But there are also lots of great tools, foam roller, massage stick, Theragun, small ball, tennis ball, cross ball massage can work for a lot of these areas here. Rising up and then bring the legs up to the other side. So we do the twist first, remember, so I've got my feet off to the left hand to that right knee, right hand behind me. That's going to help me keep my spine long. Remember, you could lean away a little bit if that's comfortable to the hips. Chest, shoulders, gaze here, gently turning to the right. And then try this little movement here. I'm going to tip the chin up and chin down. Inhale, chin up, exhale, chin down. Maybe you notice if it's different here on the sides. My left side is a little tighter. This way feels a little better to my neck. It doesn't mean I need to go do more on my left. It's just a noting to self. Maybe that's an area to work on for me with some self-massage, small ball, or how a massage therapist work on. But there's a lot of great stuff you can do on your own. I will bring that head back to center, leaning away from the legs. Here's our quad stretch. So pull the heel towards the butt and just be careful you're not bringing that foot up and kind of twisting at the knee. You could stay there, lower to the forearm, or slide that leg back. Take a few breaths. Releasing that foot and make your way onto your back. So we're coming into this figure four position. So let's cross the left ankle over the right knee and just pause here for a moment. And instead of pulling in and holding the stretch here, we are starting by just pulling that right foot up off the floor and bringing both legs towards you. Maybe you feel that little bit of stretch in the left buttocks, outer hip, or a bigger stretch, or maybe just openness. And then we lower the foot back down. So lift both legs towards you, maybe opening up the back of that left hip a little bit and lower back down. So you could keep it right here. And you don't have to lift very much. Or you can add this another similar to a sciatic nerve glide. So as I pull the legs in, I'm going to start to straighten that right knee, jut the heel up towards the ceiling, and then I bend and lower the right foot. So it's a little bit of a 2 for 1, or even buy one, get two free here because I open up my hamstrings, calf as I do that movement. Might even be a little bit of core happening with this. All right, we're going to lower the right foot down, but keep that left ankle crossed over here. Arms out to the sides and start to gently rock your legs side to side. So it's always interesting to me how very different this feels than what I just did, right? I still have the same similar leg position. This I feel much more in my lower back, um, side waist. Maybe you keep your movement small or make them a little bit bigger. You could even start to turn your head in the opposite direction of your legs. We'll bring this back into center, switching legs. So right ankle over that left knee. So this is where we pull it in. So we lift that left foot, pulling the legs towards you, maybe so you feel some stretch or openness in the right buttocks, and then we lower it back down. So it doesn't have to be a big lift. If it's hard to do, you can assist with your hands a little bit, or even having a strap behind here to pull forward and then release. You could keep it like that or pull up and then start to straighten that knee, left heel towards the ceiling, and then lower. So kind of combining two things here, which if it feels effective for both of those things, great. Maybe you just keep it at one. Sometimes adding a second thing, you kind of lose from both. All right, lower that foot down, the ankle stays crossed, arms out, gently rocking the legs side to side here. So if you have arthritis in any of your joints, that means the cartilage has started to wear away at the ends of your bones. And the cartilage has a few different functions. One is to cushion, and another is to have like sliding, gliding properties, almost Teflon-like properties, so that when you move your joints, they aren't as creaky. When you've lost some of that cartilage, it's really important for that lubricating fluid to be moving around to give you more of that sliding, gliding property that you lost from the cartilage wearing away. All right, both feet down here. And I'm coming into a supported bridge. I'm going to use my yoga block for this. It could be a folded blanket or towel. The foam roller works really well here as well. And I'm sliding this prop underneath my sacrum, that area above the buttocks, below my low back. And then take a moment here to adjust. Sometimes it being just slightly off makes a big difference here. You could stay with this. It's actually this sort of passive tractioning, creation of space between the vertebrae and the lower back, especially, or this legs up position where you pull the knees in, the feet up towards the ceiling. Just adjusting my prop here. And just notice, I don't have my legs all the way straight because if I did, then my quads and my hip flexors are kind of having to hold. I want this to be a little bit more relaxed. And then start to circle your ankles. And there might be a few pop-pops or um, clicks here at the ankles, and circle the other way. And bring this back, the feet back into center, and then point and flex. It doesn't have to be a real hard movement, just point, pull back. Relaxing the feet here. Maybe shake out the legs just a little bit. Moving any excess fluid from the lower body back up to the core here. And then we lower both feet down to the floor, lifting the hips. You could take that prop out from underneath, coming down onto your back. Decide if there's something you'd like to do here before Shavasana. It could be happy baby, could be a reclined twist that you hold. And we've done way less um, static positions today. It might feel good to come into a stretch and hold for a few breaths.
Jasmine.
All right, we're going to bring this back in to center and decide how you'd like to set yourself up for Shavasana. So you could be using props for this. You could be putting socks or sweater or blanket over top. It could be that roll under the back of the neck, how we started, that roll under the length of the spine, legs up on a chair, legs up the wall. Maybe you're just flat on the floor. I'm coming into a knock knee position here. And I sort of like that folded blanket over my low belly hips. It gives me a sense of groundedness and a little bit of feedback about my breath, as well as vagus nerve stimulation for helping me relax a little bit more into Shavasana. Wherever you've chosen or however you've chosen to be in relaxation here, perhaps you take an inhale through the nose, open the mouth, letting out a sigh. You could do that again. And then just allowing yourself to rest here. So you let the breath go, allowing your body to feel heavy. Heavy, not in the sense that you have to work to hold, but that the earth is holding you, feeling the effects of gravity, not resisting, resting for the next few minutes. Begin to deepen your breath. Invite some gentle movements into the body, the fingers, hands, toes, feet, ankles, wrist, elbows, knees, hips, shoulders, maybe a full body stretch. Inhale, lengthening out. Exhale, let it go. Bend the knees and roll to your side. Pause for a moment here on your side if you can. As you take a few more deep breaths, perhaps take this opportunity to feel some gratitude for your body, your breath, your health, your yoga practice. Press up to a seated position. Thank you all for being here, for sharing your practice, your energy. The light in me honors the light in each of you. Namaste.